My name is John Underwood. I'm a retired police officer. Actually, I've been smoking for 50 years probably. My doctor was concerned because I was losing weight, and she sent me for some blood work, and came back with very high red blood cell count. So she sent me to a pulmonologist in San Marcos. The pulmonologist sent me for a CT scan, and that found a tumor in both lungs.
Mr. Underwood came to me from his pulmonary doctor that had seen him. He had a long time smoking history. The thing that stood out was that he had spots on each side of his lungs, and I felt like knowing more about him and about these two tumors was very important. And so for that we referred him to Dr. Abedi to be able to help make a diagnosis. If they are cancer, that markedly changes the stage of the cancer, what the treatment is, whether surgery is even warranted or not.
So what we're going to be doing today is attempting to do a robotic navigational bronchoscopy that allows us to approach a small abnormal lesion in the lung of one of our patients so that we can biopsy it and determine if this is in fact a lung cancer, potentially some other infectious process that's created this abnormality on the imaging of the chest. With this new technology that we have, which is basically creating a GPS system through the lungs, through the normal airways of the lung, we make our way out to these lesions using a very small, very maneuverable catheter that's operated with a robotic system that we use a joystick, essentially almost like a video game, to maneuver. And once we get there, we're able to do these biopsies from the inside without having to puncture the lung itself, and the risk of significant bleeding or causing pneumothorax, which is what we call it when the lung collapses, is less than 3%. And so it's a much safer way of doing this, and it allows us to do things like potentially go after multiple targets in a single procedure, which is what we're doing today.
So interestingly, after he had his biopsy, he had two completely different types of cancer. I was very fortunate that he was able to have these diagnoses made when he did, because most patients who are diagnosed with lung cancer in the United States are diagnosed late. The stage is late. In fact, most of them never have the opportunity to meet with me to even consider having their lung cancer removed. Generally speaking, smokers or with a significant smoking history are eligible for lung cancer screenings. So when a patient's able to be identified early with lung cancer, that's much more favorable, and those patients are much more likely to have a good outcome, which a good outcome ranges from longer, better life, up to a cure. And for Mr. Underwood, for example, although he has two different types of cancers, both of them were relatively early stage, and so he has the potential to be in complete remission of his cancer. We removed the one on the right side, and the question now will be what is best in terms of timing for the left side.
I'm feeling great. I'm kind of amazed that I can breathe as well as I can. They removed the top lobe of my right lung, as well as some lymph nodes. If they want to do surgery on the left lung, I'm all for it. I've promised my daughters that I'm going to beat it, and I'm going to. So, no doubt in my mind.